Hello and welcome back. My name is Dr. Kieran Sodha and I'm a GP specialising in lifestyle medicine. I'm here to support you to live a happier and healthier life. Well done for making it past the halfway point on this educational programme. This session is really important for supporting you with recognising behaviours that you would like to change and begin to set small sustainable goals. There are a lot of behaviour change tools out there and we're going to try and keep it simple just for this session. Getting coaching support can also really help with accelerating diabetes outcomes. Now in this session, we're giving you a taster of 2 evidence-based methods to help you to start making those changes. These are the COM-B and SMART models. The COM-B model has been embraced as a powerful tool used by the UK government, private organisations, and also within the NHS for improving health outcomes. It can really help with recognising and removing barriers that make it difficult for long-lasting behaviour change. COM stands for capability, opportunity, and motivation, and B stands for behaviour. If you ensure that you have the capability, opportunity, and motivation, then you're much more likely to be successful with your goals and changing your behaviours. For each of these areas, there are 2 components. Now, I have seen how the COM-B model supports patients to identify barriers that are stopping them from having the great successful outcomes that they're looking for. This next part requires your participation, so a pen and paper may be handy. We're going to identify your barriers. Let's use an example that may apply to you. Let's say your goal is to eat a low carbohydrate diet. So here come the questions. Do you have the physical capability to do so? For example, could you walk or drive to the shops to purchase the food? Do you have the psychological capability? For example, do you know how to cook a low carb based meal? Now let's think about your opportunity. Do you have the physical opportunity to purchase foods? For example, is the food available at the shop or do you have enough money or time? Is there the social opportunity? So for example, do other people at home want to eat the same food? There are 2 parts to motivation, conscious and unconscious motivation. Conscious can be thought of as our logical thinking. And in the low carb example, do you know that this change will help with your blood glucose level? Unconscious looks at the parts of our motivation that are harder to control. For example, cravings. Do you anticipate any food cravings and how might they be managed? The capability, opportunity, and motivation factors all influence the behaviour of following a low carb approach. Now, by getting all the information down, you might have identified some barriers that are stopping you from getting these great long-term healthy habits. You could try to make changes that directly work to reduce these barriers. Now, behaviour change can be difficult and sometimes applying these models takes time, but we can support you through this if you're joining our coaching sessions, or you can speak to a health professional about this too. Now, SMART is a commonly used goal setting tool, and it stands for specific, measurable, achievable, relevant, and time-bound. Now, many of you will be familiar with the SMART technique as it's often used outside of the health setting, for example in education and within work organisations. After using COM-B, SMART is a great tool for achieving these goals. So let's use that low carb example for the SMART goal. A possible barrier you might have identified is not knowing a low carb recipe or wanting to learn a new one and being able to cook it. You want to make sure this goal is as specific as possible so there's clarity in what you're trying to achieve. Your goal may be to try and learn to cook one new low carb recipe. To make this even more specific, you could name the recipe that you're going to learn and cook. You can measure this by the number of days that you're going to cook it per week. For example, I will cook this new recipe twice per week. Now, you may have identified from the COM-B model that you need to make sure that you have the right ingredients at home. So you may also change your shopping habits to make this achievable. Now, this goal is relevant because it will support improvements with your blood glucose or diabetes. Now, consider how long you will need to follow this behaviour change for it to be time-bound to know when you've achieved your goal. For example, 12 weeks. Your overall SMART goal in this example may be, I will learn to cook one new low-carb recipe twice per week with my partner. I will make sure to have the ingredients available and learn the recipe. This will improve my blood glucose control and I will know if I've achieved it if I'm able to do this for 12 weeks. It is best to set smaller and more realistic goals in the beginning to ensure that they're sustainable, achievable, and easier to stick to. Over time, you'll make a number of changes, which is something that we call habit stacking. These changes will build on each other, so the effect starts to multiply. So what's the one change you might make after today's session? We hope this session has given you an insight into the importance of behavior change models and how they can support you to have great health outcomes. We hope that you can start applying these models too. But before you go, I'm going to ask you 2 more questions. 1, what do you think is stopping you right now from achieving better health? And 2, it's important to celebrate your successes. So what has gone well for you that you could do more of? The positive psychology and mental well-being session can be really helpful in improving the chances of behavior change success. So do check out that session. We'll see you then.